Everyone, I'd like to call to order this April meeting of the Delaware County Jail Oversight Board. If we could all rise for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice.
Justice for all.
Joining us remotely today is the solicitor Shelley Smith from Archer and Griner and Ms. Deborah Love from the board. I would also like to announce that we did have an executive session yesterday to cover matters related to public safety, personnel, and real estate matters. And with that, we can move to the first round of public comment, which as always is limited to items specifically on the agenda for today. And please leave your comment, please keep your comments to 3 minutes or less and give your name and address to start. And there would also be another round of public comment at the end, which can cover any matter associated with the jail. Are there any members of the public that would like to speak? Hearing none, we'll move on to an approval of the March minutes. Is there a motion to approve the March minutes?
Motion. Second.
Thank you, Mr. Court. Thank you, Controller Phillips. Is there any comments or questions associated with the minutes? Hearing none, all in favor? Aye.
Aye.
Any opposed? The ayes have it. And an approval of the March report.
Motion.
Thank you, Mr. Corson.
Second.
Thank you, Ms. Love. Any questions or comments? Hearing none, all in favor? Aye.
Aye.
Any opposed? The ayes have it. With that, we will turn it to the warden. Good afternoon, Warden.
Councilman Madden, members of the board. I'm sorry, say that again, Sean? Sure thing. Thank you. I'd like to start by saying Ramadan Mubarak and also acknowledge that we also celebrated Passover and Easter. It's been an enormously important month for a great deal of religious observation, and just wanted to make note of that. I appreciate the opportunity to be here for the April meeting to discuss matters related to the facility since our last meeting. As typically discussed, we'll start with infectious disease updates. Delaware County was actually reduced to a low transmission rate, and we continue testing predominantly for those that are being transferred to other agencies or jurisdictions. In March, we tested 55 incarcerated persons. 1 out of 55 were diagnosed as positive for COVID-19. Our facility has 0 positive cases currently. The total incarcerated population that is vaccinated is 727, accounting for 56% of the incarcerated population. Our facility did not host any vaccination clinics in the month of March. We presently have 0 staff out with COVID-19, and there are no confirmed or suspected cases of monkeypox in the institution. Our current population as of this morning, so we fluctuated a little bit with our continuation throughout the day, was 1,293 incarcerated persons. That is an increase of 28 from last month's reported population. Our weekender program, we had 70 participants in the month of March. 13 of the 70 were first timers. 3 of those were female. We had 552 commitments and 557 discharges.
We're just to interrupt you for one quick moment.
Sure.
The weekender program, when we see these numbers, is that included in the 1,293 or is that in addition to?
No, so those individuals are reporting throughout the week, but most typically on Friday evenings at 6 p.m. So the population number was actually today's population number. So that is not an average. It is the population number that we had as of this morning. So 70 is those that were sentenced to the weekender program and have been reporting. as stipulated by the courts.
I was fairly certain of that, but I've gotten that question. I want to confirm.
Perfect. I appreciate, opportunities to clarify the record. We had recreation, as most are aware, since August of last year. We've been providing full recreation for housing units to encourage the population to be out of their cell as much as possible. We deviated from those expectations on 4 separate occasions during the month of March. We can see those. Unfortunately, on the 14th, we did have several power outages. George W. Hill is situated at one of the high points in Delaware County, and wind does definitely impact our facility. For safety reasons, we made sure to just keep the facility on lockdown during that time period. First shift, they were afforded full recreation for the day, so it is important to point that out. We also climbed an extraordinary amount in video visitations. So during the month of February, we had 6,766 video visits that were completed on the housing units or blocks. That doubled. We went to 12,536 video visits. So this is definitely a resource that is being utilized by the incarcerated population. I want to be clear that we've not yet added any additional times. So we're still phasing in this process, and we do anticipate that these numbers will continue to climb.
On the video visits.
Sure
And
thing.
I'm sorry if I'm catching up, but so the video visits are on their tablets?
Yes,
Okay. And they are allotted a certain time frame when they can do it? Is that what it is?
yes,
Okay. And so then they can have their family members call in to their tablet?
no,
No, they call out.
yes.
Okay, so they call out, and is this during restricted hours, or how often do they get to do this? I assume it's not willy-nilly.
Correct. So we do have a schedule that's in place, and I used to include it on the slides,
It's okay.
but I think it's important to discuss. The majority of the population, so all of the population, has access to video visits during typical recreation times in the facility during the morning shift. And we were originally testing the bandwidth of our wireless access points to make sure, because streaming of live video does take quite a bit of technological resources, and that is not my wheelhouse, so I can't articulate it to the degree that those professionals could. We do have on our worker unit, which is unit 4, as well as our juvenile population, additional time slots for visits, and those afford the opportunity for video visitation to happen on the block during the evening hours. And that's to accommodate a lot of our incarcerated persons that have jobs. They're working during the day, and we want them to have the same rights that other members who work during evening shift would have, so they get the evening time. We will be expanding the entire population to receiving evening hours of visitation.
Can they call their attorneys?
They can always call their attorneys. So phone calls are very different.
Well, I meant video. Can they use the video times for their attorneys?
They could, however, these videos that are conducted on the blocks with the tablets are not privileged communications. So in order to abide by the standards for attorney-client privilege, yes. So you may, but I don't know if the public would know. So we can't record those. We do have the capacity to do video visitation in video court, though I would say that right now that is solely designated for the purposes of court proceedings and not to facilitate FaceTime video calls with attorneys. Attorneys are always permitted to come in. We host professional visitors constantly, 7 days a week.
Okay.
Okay,
Thank you.
thank you. Major incidences. I want to address that we did have a facility event on February 12th, and this has now been discussed at the February meeting, as well as the March meeting, and now the April meeting. The only reason to bring it up again is because it is important to provide additional information. The facility death that occurred, it was originally reported by me as being either natural or sudden. That was a provisional kind of report that we were receiving from the nature of the events and the initial physical examination. This has since been rolled a homicide by the medical examiner. And though I can't provide, further detail into the nature of that determination, it was ruled a homicide as a result of an incident that occurred prior to the commitment of the facility. So I felt it important to correct the record because I had previously stated something else publicly, and we have had to modify the report that was submitted in terms of this facility death.
Morton, I think we can also clarify when we say prior, pretty materially prior.
Yes, materially prior. However, I am not the expert that would make that ruling or determination. That was substantiated by those that are authorized by nature of their position and training. But it is important, I think, for us to make sure that there is a clarification of the record so that we are providing accurate reports.
Yeah, and I think that clarification specifically because of the fact that it's been referenced by others as giving the suggestion that the homicide occurred within the facility, which is definitely not the case.
Yes. We did also have an extraordinarily unfortunate event on March 23rd. We had a death within the facility, and this was a death that was by suicide, and the nature of that was by hanging. This was an 18-year-old male that was found to be in their cell. Our staff engaged in all emergency procedures and response. Despite all of their efforts, they were unable to revive the individual. And unfortunately, the time of death was called within the facility. We worked with corresponding partners, the medical examiner's office, as well as CID, and this remains in an open investigation within our facility. We also had another loss within the facility during this past calendar month. And on March 16th of 2023, Officer Kevin Regan had his end of watch. He was an Army veteran and worked at our facility since April 8th of 2002, dedicating nearly 21 years of service to Delaware County. He worked in many different positions in the facility and served as a member of the executive board of DCPEIU, fiercely advocating for his fellow officer. He was a correctional officer, a veteran, a husband, a father, a son, a friend, a CERT member, a problem solver, a fixer, a listening ear, a coffee consumer, a person who would get it done. He was so much to our agency, so much to the staff that I have the privilege to represent, and so much to many others outside of our walls. And we wanted to ensure that we acknowledged his life and service during this month's meeting.
And I'd also like to pass along our condolences from the board to his family and friends.
On March 17th, we honored 14 correctional officers and 1 sergeant as they completed their academy and were sworn in. We also began a class of staff on April 3rd of this month, which includes both correctional officers as well as healthcare staff. And we do have classes scheduled to begin on May 1st and May 29th. Typically, we average 1 class per calendar month, but we have been staggering these every 4 to 5 weeks. And just because of the nature of how this fell, we will have 2 in the month of May. And you can see in the picture, that is the class photo from March 17th of class 0223A that completed the academy. Employee of the month. Our April employees of the month, and one of them was actually pictured in the previous slide, Tamika Bennett Bowens, who is one of our instructors within the academy. She's been a long-term employee and has supported efforts in modifying our training department. Lieutenant Tyrance Moore, he and his team actually took on the challenge of revitalizing our intake department and repainted the entire facility. Augustine Say and Abdulkader Saduki, both correctional officers who were recognized by both supervisory staff as well as peers for demonstrating accordance to policies and procedures and providing inspiration to our employees for the work that they do. Though this didn't happen during the calendar month of March, it is new, and it is important to also acknowledge that though we still have a large number of missions that need to be completed and continuous process evaluation and improvement, we have made some continuous strides in the agency, and more importantly, need to remind staff when progress is noticed and provide some acknowledgement for their efforts. On April 6th, we held a ceremony in which we acknowledged the anniversary of our transition day, and we provided multiple awards. These were mission awards, and they were to address the core institutional values of the facility. Nominations did not come from the administrative team. They came from peers or other supervisory staff throughout the institution. Employees were nominated, and there were also opportunities for people to write statements to support the reasons why they felt the nomination was appropriate. And we had a large volume, so 14 different core institutional values. We had 14 of our employees acknowledged, and they are appearing there. We also had the opportunity, again, this was nominated by all of the employees of the institution, to recognize an employee of the year as well as a supervisor of the year. And our correctional officer who passed, Kevin Regan, was named employee of the year, and our supervisor of the year was director of records and booking, Michael Root.
If we could just pause for a moment, I wanted to recognize the warden and the leadership team. I think it was a really tremendous event. I think we were clear that it was an acknowledgement of this important milestone. It's not a celebration of mission accomplished, because there is still much that we have to do. But I think it was really a great opportunity to recognize the entire workforce. I made the remark last week that I think when people join the workforce at a corrections facility, they don't realize that they're joining the largest mental health facility in the county. It is a very challenging job, and they have before them a significant task looking out for the safety of their colleagues, those that are in our custody, and the community at large. And I think it's important that folks get recognized whenever we can for the public service that they're providing. So thank you again. I think it was a really, really wonderful event.
Thank you. It was wonderful to see so many county departments, many of which we rely upon. We were also able to acknowledge how they've contributed to the success and advancement within the institution. And I think, a county of this size, we will never know all of the work that is done behind the scenes. And when we can take a moment to pause and really reflect, because these things do not happen overnight. There was a large amount of work done by members on this board, as well as previous members who have championed different changes throughout the facility. And I think that provides continued motivation to all of us to make sure that we maintain our mission focused and that we continue to achieve care, custody, and control. And also just remind ourselves how many different things that means and how we accomplish that mission is different, but every single person in the facility is of value to contributing to that. So I think it was well received by most people, and it was great to feel the support from the county. And I know that the employees took note of the amount of leadership that was present as well. We are still seeking opportunities for employment, and someday I look forward to not having so many vacancies. Though I will say, some of these are a direct result of a restructuring that is ongoing and continuous throughout the institution, that many of these positions were supported by the Jail Oversight Board to make sure that we are meeting minimum standards or exceeding standards, that we are able to be progressive in how we approach the field of corrections, and that we are able to continue to expand upon our mission. And with Jail Oversight Board support, we intend to make presentations to the Personnel Board moving forward to adjust compensation rates as indicated and definitely demonstrated by competitive studies for the continuous restructuring of the organization. And we have every commitment that these requests will be budget neutral. In the event that they would be impacting the budget in any way, or that we would be increasing the headcount or developing a brand new position, we would be bringing that forth to the Jail Oversight Board. But we can see the list of vacant opportunities. Anybody who might be listening in and is interested in applying, these are all available by Googling George W. Hill Correctional Facility, and you can go navigate to the careers page and apply immediately online. We can also do inquiries throughout the HR department. We've got great staff who's there to assist in guiding individuals to this. Cost recovery. The left-hand column is what was collected during the preceding calendar month. The right-hand column is the year-to-date total. So we are still collecting processing fees, which goes to the county general fund, damage to prison property, medical visits, those are the sick calls, postage, and then those funds that are deposited to the inmate welfare account appear in that bottom line. Those are any persons who are leaving the institution with less than $1 on their account. Instead of issuing a check, we do absorb that into the inmate welfare account. Goal setting. We haven't crossed anything else off because we haven't completed anything. And I've been very diligent to only cross it off if I feel like it's been completed. However, we are making progress. So though this is situated under training, I think it's more of a facility opportunity to learn a baseline of operations and make sure that we're relying upon other standards as well as organizations that employ their education and knowledge to assist in our learning. So our agency right now is presently participating in a voluntary study with the Bureau of Justice Statistics. And you can see kind of the advertisement for what they sent in brochure to many different agencies. We see this as an opportunity to really learn from experts who have traveled nationally to different institutions, many of whom have been in facilities our size, larger and smaller, and that we're going to learn a great deal from this. They conduct voluntary surveys. So a random sample of incarcerated persons is called and requested to determine whether or not they want to participate. They have an opportunity to meet with the surveyors. We do not control, meaning the administrative staff, any of the surveying. That's done exclusively by the researchers that are on site. They do have IRB approval. We are not, making sure that identities are protected. And they also receive cookies if they do choose to participate in the survey. So that is ongoing. One of our deputy wardens is still behind on site right now to make sure that this is continuing facilitation. The goal is to get at least 170 participants, and they base that off of the facility population. So they came in with that number, and we're hoping that we're not only going to meet that minimum requirement, but exceed it. Additional progress. So the body scanner, we had completed the site survey. And installation is going to be this week, as well as training ongoing. We are very much looking forward to this security measure and advancement to put us in line with other correctional agencies and make sure that we are conducting appropriate searches of everybody to make the institution safer. We are also progressing in terms of camera, as well as other safety measures within the facility. And we have been engaging multiple different vendors to ensure that we're informing the decisions, to articulate the scope of the work that's being completed. This is being largely led by PSE in collaboration with Public Works. This project has been ongoing, I'll say for years, though you guys could confirm or deny, with the initial input of experts such as CGL, as well as Alta Management, that started this process of procurement for drawings, as well as surveying occurring and going on. And we have reached to the point of 100% of completion of drawings, which includes beacons for duress monitors, as well as cameras, locking mechanisms, and increasing radios. And we would like to be able to move forward in our presentation to County Council to request advertisement for bidding this project. But before going to council, we need to ensure that we have the support of Jail Oversight Board in order to do that.
Warden, remind me what has been thus far. I know this isn't the first time we've talked about the security camera project, but what at this point do you need in terms of formal support? Is it for the drawings to go now to the next step of
The formal request is for an advertisement to bid the project and to gain bidders who are qualified to perform the work, which will include multiple different trades because we have electronic measures that will be taking place. Those will be further articulated in the specific request in front of County Council in terms of trades that would need to be engaged. It is important that we reiterate, and I failed to put it on the slide. This has been presented to the Jail Oversight Board at a macro level. We've received some cost projections, but they are simply that. They are projections. And we have ranged between $16 to $18 million for the scope of the project. So that is important to also make public record and notification. At this time, this is not committing us to any agency. It is not committing us to a specific lock or camera. It is, however, allowing us to progress through the process and advertise to see whom may be engaging with the county to do this work.
So if there's a board member who would make a motion to recommend to County Council for advertisements to bid on this, and then we can have discussion after the motion's been made.
I'm gonna make the motion yet until I have a question. I do have a question.
Yeah, Judge, why don't we can make the motion a second, then we'll have
Okay, that's
discussion.
fine.
Yeah,
However you
I
want.
definitely won't go
It's
right
fine.
past that opportunity.
Motion to recommend to council that the warden and prison staff be permitted to go forward with the request to advertise for bids for cameras and locks.
And is
Second.
thank you, Mr. Corson. So any questions or
I
comments?
do. So, when we were talking, can they be parceled out, the locks and the cameras? That is like $16 million sounds like a lot of money. So I'm wondering, is this something, or are they all connected?
And I'm just going to caveat any questioning in this area. I obviously want to state for the public that warden, you'll obviously use discretion about what can be answered in a public forum and what would compromise security.
Absolutely. So the full scope of the contract is comprehensive. So I feel that I can confidently state a process of this magnitude will require us to actually move the incarcerated population out of housing units to conduct the amount of work that will need to be done to modify locking mechanisms and or add any wiring for cameras and duress monitors and fixing the intercoms within the cells. So this will involve a large volume of movement within the facility, and it is slated to be comprehensive. This dollar amount was, and you could correct me if I'm wrong, also already projected within the capital improvement project for public works. So this is embedded within that budget, and I do believe that funds were earmarked for the magnitude of this project.
And they were. And I'll say, you know, just as a stepping back, I think we've discussed in the past how over the 20 years of George W. Hill's life prior to the last couple of years, there had been a severe lack of investment in this facility. I think what's currently in the capital plan for the next 2 years exceeds the entire capital investment that the county made in the 20 years prior. And one of the significant areas is this, the camera coverage, in addition to the kitchen, which is the next item on here. But there's some pretty significant projects that really do need to be advanced.
Yeah, and I always add whenever this comes up is that this responsibility for capital improvements always lie with the county, even during the time of being under private management. It was the county's responsibility. So I think a lot of these things that have been planned for, because they are either old, outdated, or don't work the way they should now in 2023 and beyond. So so that capital planning has gone on with the capital budget as well. So but it always was our responsibility.
Any other questions or comments on this motion? Hearing none, all in favor for this motion? Aye.
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 Any opposed? The ayes have it. And I do want to just make a point of order. I've asked Mark Woolley, the Chief Administrative Officer for the county, to join us. Mr. Lazarus, the prior executive director, his last day was at the end of March. He is no longer on the board. That does create a vacancy. And while Mr. Woolley isn't technically executive director. I think he can provide input from the broader county perspective. And so I've asked that he join us up at the front as a advisor, but not a formal member of the board.
Thank you and welcome, Mr. Woolley, to your official seat here. This item is not for action, more for notification. So you did reference another large engaged project for capital improvement within the facility. This has been something that has come up in previous Title 37 inspections that are conducted by the Pennsylvania Department of Corrections and is within our work plan to engage and resolve the challenges within this area. In last month's meeting, we did receive Jail Oversight Board approval to re-engage Bernardon, which is an architectural engineering firm that had previously worked with the county to attempt to find a plan for the kitchen. We did have a kickoff meeting with Bernardon very recently. So though there are no items for action, we did have a proposed set or schedule calendar of events for proceeding forward, which is very encouraging. It is an aggressive timeline, so we will be providing update over the next couple of months as decisions need to be made and board support needs to be gathered to move the project forward. We do believe that though not all of these will be happening by mid-June, some happen before, that we'll have a development of schematics, designs, and projected costs anticipated by mid-June. The last one to be established will be the costs. Right now, we're evaluating several different scenarios for how this work might be accomplished, and we will still be able to ensure that we're providing safe food for the entire population as well as our staff. So we are doing a large amount of exploration into the different options, all of which will impact the projection of cost. So we may have a few different determinations to make at a later time. And as stated, we will continue to keep the board engaged as we're making those decision points. Aramark Commissary. So this was referenced during last month, part of their annual contract review, which is typical, has included an increase of items on the commissary menu. And that was largely driven by the incarcerated population making requests. They wanted additional items or variety of items to be added to the menu, as well as more expansive sizes for some of the clothing items or shoes that might be available on our commissary menu. You can see that we have 100 new items that have been added. Prices have increased due to rates of inflation and increases in the consumer price index, also referred to as CPI. And that is permissible and allowable by contract up to a certain degree. They're within the parameters of that. And we were able to furnish the board with the full menu as well as the prices. The menu will be enacted and made available to the population. So we wanted to make sure that that was a point of discussion during the meeting.
And Warden, with regard to the options on the commissary and the pricing, when would be the appropriate time? Do you want to have that conversation now?
Whenever you guys would like to. I think it
Sure.
would certainly make sense while we're on the slide to have any further discussion that might be required.
Yeah, I would agree. And so for the public's benefit, there was a few options that were provided, offering a few different price points. For background, there is a commission that the county, and I'm going to sort of put county in quotes because what is kept by the county in the commissary sales goes back into the inmate welfare fund. And those funds can only be used for certain things that are for the benefit and welfare of the incarcerated population. With that said, I think there's a balance of how much should be charged in light of the fact that pricing has already increased pretty materially given inflation generally. You know, I think this is something for the board to really weigh in on in terms of what would be that right point. So I think I guess you don't have it on the, yeah. I don't know how best to really navigate this. How many columns were there that were?
So there were 4 different tiers,
Yeah.
and to fill in the gaps, because all of the information would not necessarily be made public,
Right.
but it would be important to designate that right now we receive a 47% commission rate on items that does go into the inmate welfare fund. And so the request, as we were negotiating with Aramark, was to adjust and reduce prices for commissaries. So when we received the original menu, it was not acceptable to us. So we are all subject to inflation, but the rates that we had originally received seemed a bit out of bounds from what we expected would come through based on those original CPI increases. They agreed and thus submitted a proposal for lower rates. And then they also provided us information that commission rates do, unfortunately, drive some of the prices as well. So they gave us the opportunity to evaluate where the prices would be at 4 different tiers of commission. That is not something that I have control over, but it is something that could be voted on and designated as what the right amount was. So they did provide us with those tiers for consideration, which was shared with the board for their own determination and deliberation.
And the range, you sort of gave the high end of the range from a commission perspective, just for purposes of this conversation. The low end of the range was what?
32% commission.
So I, at this point, I would open the floor for the thoughts of board members as it relates to sort of that balance between more into the inmate welfare fund versus keeping the pricing lower for the inmates. So I don't know if anyone has any thoughts on the matter.
I was just wondering if we could be refreshed on the balance of the inmate welfare fund. I don't know whether Deputy Mr. Sturdy might have that number.
$4.1 million.
It's pretty well funded.
It is well funded, and I think there are some pretty significant limitations on what that can be put toward.
Right, which just for the benefit of our other members that are new, our judges, we talked about getting the chairs for the inmates, and what we have applied some of that money to some of the purchases that have been made that do benefit all, but it is a restricted fund and it is governed by law what you can do with it. So, but I have to say that is a big balance.
It is a large balance. And I think that there's also been a duty of responsibility of what is the obligation of the county to provide versus what is in excess of that and benefits the entire population, which I think has, I don't want to say limited, but it has certainly guided the utilization of these funds. And we've not tapped into it, which is why it continues to grow.
And Warden, just as another kind of point of background that I think might be useful for all of us, and you may not have an exact number on this, but in terms of the monies that contribute to the inmate welfare fund, where does commissary sort of lie in terms of the, ideally kind of on the pie chart of sources of funds? What percentage is it? Or another way of sort of putting it would be just, is it the top contributor to the inmate welfare fund?
It is the sole contributor. So it is the only way that fund grows. And that's not meant to be prescriptive. It's just, that's how that fund grows. And I believe that we're averaging, though my deputy can certainly correct me, I think comfortably $150,000 is contributed monthly. A little less, it's less than that, but that would be on the high end.
Okay, and I think also one other point is whatever we sort of do here isn't sort of set in stone, right? So if we're seeing other opportunities in the future to tap into the inmate welfare fund for the benefit of the inmates, we can certainly, and we're not getting enough into the inmate welfare fund, we can always adjust this in the future. I'm sorry.
Is there an industry standard for what the commission is like across the board?
I don't want to say that there's an industry standard because that usually is set by an accrediting body. So there's a wide range of what different facilities are utilizing. What I can say confidently is 47% is at the high end of commission based on at least my awareness and knowledge of many of the county correctional agencies in the Commonwealth.
And Warren, just to just to set the record, this was probably 99.9% of the sourcing for the inmate welfare fund, but I guess there is the dollar or less in people's balances that goes in, but that's truly a rounding
That's
error.
very nominal.
Yep.
Yes. Mhm. But it is a point of clarity that technically this is not the sole source of funding. It is the primary overwhelming source of funding.
Yeah, 99.99%.
Remind us what the percentages were. I'm sorry, I couldn't pull up what you had given us, and I know 47, and I think the lowest was like 32 was the percentage.
I believe,
And I think there was 37 in there.
and I would like to be,
Yeah,
I have it in front of me. That's correct.
so is it 47, 42,
35. is
35.
32.
and then 32?
That's right.
That's what I thought,
Okay.
yes.
I knew that there was a range of those. So it would not be unreasonable to suggest that we could have a lower percentage on the commissary and still be funding the account that is currently standing at 4 million.
Correct.
Okay. Well, just saying, I think we should lower it then. Absolutely. And if we're going from 47, heck, I would go to the 35 but I don't really know the full impact of the numbers, but if it's money that's going in, so when was the last time money came out of the fund? Just like, are we talking months, years, weeks, yesterday?
We've made several propositions and proposals to the board in which we have funded different items. So I can't remember which one was the most recent, but to just kind of review, we've done chairs for video visitation, exercise equipment that is going to be added to every recreation yard, pull-up bars that are being added to every recreation yard. Law library services does come out of that account. I know I'm missing some,
No,
but I've definitely
how often?
requested.
When was the last time money came out of it?
The gift bags at the holidays.
Yeah.
Some material purchase.
I think the holiday gift bags were the last deduction.
Holiday gift bags.
Every
for-
incarcerated person received a gift bag.
That was nice.
Yeah, I mean, I'm totally in support of reducing this amount. I just also wanted to be clear that, we've been in control of the jail for a year. That account came over from Geo. Geo was maintaining that account.
Right,
And
no,
it came
no,
as part of the
I-
closing.
My
I just
point
want for the
asking the
public.
question was to know whether or not this is an account that is actually accessed on any regular basis, and it's sounding like the answer is not really.
Well, I think it is. I actually do think it's active, because as
Okay.
any of these purchases that we've done in the past year, we've definitely drawn on that account when it goes to county council to say the source of funding for that acquisition. The video chairs that was a significant purchase, and as well as the exercise equipment. So I think it has. And then I do think that the idea of gift bags or whatever, I mean, that is helping just maintain the morale of people during different holidays, and I think that's needed. And I also was wondering if it also went to some indigent people, excuse me, that that don't have any wherewithal for any commissary, because it's really, I mean, that there are people that don't have anything. So I mean, but I'm in favor of going down to 32% because I don't think it's going to be a material impact on the fund. And if we decide that it is, we can increase it later.
I agree.
I agree as well.
Go ahead, Ms. Love. You agree as well?
I do, yes. And I agree with everything that Joanna just said about the whole situation. So yes, I'm in total agreement with letting it be reduced.
And I am as well. I think given how much inflation has hit everyone, and the fact that if we're not bringing in enough into the inmate welfare fund to cover future projects that we have before us, we can always adjust. But for now, I would go with the tier 4. I would go to 32 personally.
I agree also.
I would make that motion to drop it to 32%.
Second.
I hear a motion and a second to go forth with the tier 4 for pricing for commissary. Any other Comments, questions? Hearing none, all in favor?
Aye.
Aye.
Uh,
Any opposed? All right, the ayes have it.
Thank you. We'll work with Aramark just as a point of clarity to make sure that that pricing amendment comes through for signature with the county. Aramark Dietary. So we have two contracts with the same provider, but for two different services. We have, again, worked collaboratively and in partnership with Aramark to adopt a heart healthy menu. This has not yet been enacted for the population because it is tied to, again, a contract amendment. We did have them present during last month so that they can talk about their commitment to increasing program availability and serve safe certifications. This change is really driven again by the population making requests related to the diet that's being served throughout the institution. Modifying this heart healthy diet would be for the entirety of the population unless somebody had a diet that was ordered for religious observation purposes or a medically therapeutic diet that was ordered by our healthcare department. So they would have deviations from this menu. This dietary change allows for increased vegetables and fruits, as well as ensuring recommendations for proteins are provided consistent with dietary standards. This was developed by a registered dietitian that is employed with Aramark, who was able to make these recommendations based on the specification requests. We also address the necessary increases in price per tray due to rates on inflation and increases in consumer price index as allowable by contract. And just as a point of note, the current cost per meal right now is $1.44. And with the transition to a heart healthy menu with the 3-ounce protein per meal, it's $1.68 per meal. And these are prepared on site in the kitchen and then distributed to the population. We are grateful for the commitment and partnership and discussions with Aramark to make sure that this is going to have a budget neutral. So it does not impact our operational budget. We are able to sustain this without requesting additional funding from the county. So we will be improving the quality of meals without driving the prices in the county, though this will be subject to an increase in pricing. So really wanted to thank them for their extensive work and also acknowledge and recognize Deputy Mastrati for all of the commitment that she's had working with this vendor to make sure we can get these contract amendments correct and in line with strategic county missions as well as facility missions.
Yeah, and I want to really echo that thanks. The food is always going to be a topic that we hear a lot of from inmates and from their family and from our corrections officers who also share in the meals. And, you know, I don't think we are ever going to see meal quality be at the standard of a, you know, Michelin star restaurant. But what I do think is important is that it's healthy and that it's of a certain quality that is appropriate. And, you know, it takes two in a partnership. I think we're showing a commitment to make a significant investment into the kitchen so that Aramark is set up to succeed. But I also think it's important that we hold our partners to a standard. And so I appreciate the work, Warden, that you put into this and to your team to get to, I think, a really good outcome here that improves the expectations on the health of these meals.
Thank you. The credit is truly to my deputies who, specifically Deputy Mastrati, for her work with the organization, but do appreciate the acknowledgement so much.
Well, my recognition to Deputy Mastrati.
This is Deb Love. I have a question. How, I appreciate all the work and congratulations to all involved, but how do we raise, how's the price per meal raised, but yet we're budget neutral? What happened there, or was there a breadth of budget? If you could just answer that for me, that'd be great.
I appreciate the question so that we can provide clarification. We did project, you know, because we knew that we were engaging Aramark in these discussions. So within the budget that we submitted to council, we did actually project at a higher rate of population because we do not get to control our population. So assuming that we maintain what we've been seeing historically throughout the last year, that is how we're absorbing the cost. So we designated numbers at a higher population rate and are able to thus absorb the cost. It does not expand what we had previously allocated toward the projected cost of this contract.
Thank you.
Yes. $1.44 to $1.68.
But the amount of meals is massive. It's like 3 meals a day for each person, and it's
Increase, yes,
increased.
per tray. And so a population we reported earlier, 1,293 times 3, that is being prepared within the institution daily. And we are also providing staff meals. We accommodate medical diets, religious diets, as well as court meals, which have to be a little bit easier to transport and eat.
I totally support this. I would just think the quality of food, a more healthier meal menu has to just contribute to overall well-being in the facility. So, I mean, people only have so many basic things they can have, and one of them is going to be their meals. So I support it, and staying within budget. That's great when there was an ability for them to have an increase as well. So I think it's a win.
Thank you.
For everybody.
We do our best to project and anticipate to provide for the necessary expansion that we see. I do have an opportunity for any additional questions that I can answer for the board, but I will also be providing the deputy warden's report. So you still get your opportunity to ask. Deputy Warden Falley is currently at the institution assisting with the facilitation of the survey that's going on, which is why I'm providing this portion of the report. So quarterly, we typically go into a little bit of a deeper dive in terms of programs and reporting out numbers, able to highlight the success of the incarcerated population who is engaged in these services, as well as the staff that are providing them. So we have worked with DCIU, which I know that we discussed last month for the youthful population. So we do have individuals in our facility. Our present count of individuals under the age of 18 is 7. They are receiving in-person, in-class instruction that is occurring on their housing unit from 4:30 to 6:30 p.m. to cover English, language arts, mathematics, and sciences. And we are extremely thankful that we had the opportunity to really address this need with Bob Gallup, Matt White, and the rest of the teachers for DCIU. And I think it's important to just acknowledge once again that these are all full-time employees who do this work on a part-time basis. This is in addition to their full-time employment, and they are also working evenings and weekends to provide these services to the population. We already acknowledged earlier that we are presently observing Ramadan, and we have 195 incarcerated persons who are registered to participate in the final feast. Ramadan began at sunset on March 22nd and ends on Thursday, April 20th at sunset. We also hosted a sacrament of reconciliation and Easter Mass that was provided by St. Thomas and Father Stephen Schott, and that occurred on April 10th for the incarcerated population. Our GED passing rate for the quarter is 68%, which is truly extraordinary. So there are 4 components of the GED test. Many really struggle. I would too, as demonstrated in last meetings with math, but we have a very high success rate for GED. This is an enormous testament to our 2 full-time instructors, but I do have to particularly shout out Colleen Gilmartin, who for a very long time was the only full-time instructor, and those that complete the testing, which are Joan Skursky and Kathy Hill. Kathy Miller, my goodness, sorry. I realized as soon as it came out of my mouth, I said the wrong name. We also hired a new MAT coordinator, and it's important I'm using the royal we. This is really a WellPath employee. So they are hired by WellPath, which is contracted with the county to provide these services. So we have onboarded the medication-assisted treatment clinician, Dimitri James. So board members who have participated in some of the inspections on the facility or visited, just to make sure that their presence is known, have definitely heard that we have been providing medication, need to circle back and make sure that we're providing group and individual counseling services. So Dimitri's going to be the one that's headlining that. We're glad to have him on board. We recently extended job offers for the case management vacancies that we have. We are continuing our partnership with the Delaware County League of Women Voters for municipality election, and we've also been working with the Board of Elections within Delaware County to make sure that we have the ballots available for our incarcerated population. We're in current discussions with Delaware County Foundation for a fatherhood program. So we're exploring opportunities to be able to increase those services. This is largely driven by the incarcerated population wanting to have assistance and resources to maintain connection with family and kids. And then we're also, we've been rolling out department by department electronic submission for requests for information as well as grievances. The first graph, you can see our average daily population is unfortunately climbing, as is our youthful offender population. The highest that we had was 9 at one time. As I reported earlier, we are currently housing 7 youthful offenders within the institution. You can see that we are seeing a trending with intakes and discharge. The education and workforce development. So on the left-hand side of the screen, we have GED in terms of passing rates. You can see that we are continuing to expand and engage additional persons in this program. So we are climbing each month in new students that are enrolled.
I just wanted to pause on the population levels and put that into a wider context for those who don't attend our meetings every month. But I do think it's important to note a couple things. One, we do typically see a seasonal increase in population as we get into warmer months. I don't know if we're yet seeing that here, but that could be one part of it. And secondly, I think, again, broader context, prior to COVID, when we were looking at 2018, 2019 numbers, the population was more in the range of 1,800. So we are still substantially down from where we were only a few years ago, although it is certainly up from its trough early in COVID. But, you know, while we don't like to see the population go up ever, you know, I think it's important to put that in the broader context.
Absolutely. So we have GED services on the left, workforce development on the right. And we have 2 different programs right now that are presently offered for workforce development. One of which is a flagger certification so that individuals may seek employment with construction entities in the community and be able to be trained and certified in operations of flags. We also have the Spartan Chemicals certification. This is largely related to management of floors and chemical control. So we do have individuals, and as you can see, that program is continuing to expand. The intention from the administrator of these programs is to make sure that we're providing skills that will allow and increase the likelihood of somebody's employability in the community once they are discharged. We have modified and adapted and will change at the recommendation from discussions with Mr. Corson predominantly in last meetings to identify how many persons are impacted throughout the facility for these different healthcare services. So you can see we have a large volume of persons who are being reviewed for these different services. Well beyond, or I'm sorry, these are still the number of encounters. The services are for detox and withdrawal, 163 unique patients received 605 different patient encounters to monitor their processes. For sick call, we had 800 persons who were seen for sick call or acute care. For dentists, 244 that had 615. So you'll see they may have an initial assessment or screening and then additional action items that result from that. For mental health services, 894 persons were seen 2,722 times during this quarter. And then for chronic care, we had 264, accounting for the 677. So though in this presentation, we're still seeing the total number, we'll make sure that we're putting out the independent patients just so that you can best understand. We have 70% of our incarcerated population that are prescribed medication within the facility. The large volume of our population. So that could either be for behavioral health or physical health needs. We can also see the numbers of persons that are engaged in our substance use or mental health services. Prep 1 and Prep 2 there is some court-ordered individuals. There are also individuals who are volunteering for these services or are recommended for the services based on staff review and analysis. We have anger management services, behavioral modification, as well as Alcoholics Anonymous or 12-step facilitation. Of those that have substance use disorder, we just provided some demographics as well as additional demographics in terms of age range and the drugs of choice. And I think that this is important because we are seeing the large volume of those coming into the institution are predominantly utilizing substances of opioids. So I think that this certainly demonstrates the agency's commitment to filling this need and making sure that we're engaging persons and services to include medication-assisted treatment. We are doing continuation for all forms of medication-assisted treatment. We are doing induction for buprenorphine as well. We're still in the early stages of methadone, so we have not inducted anyone other than a pregnant female on methadone, and that will be a future step to make sure that we're doing continuation and induction for all verified forms of medication-assisted treatment. We had seen a decrease, and we did discuss this during last Jail Oversight Board meeting related to Narcan. We have increased with continuous education and reminding of process and procedure for this. Interestingly, there's just a point of note that there's likely going to be movement towards an over-the-counter option of Narcan in the future. So it's just important that people don't know that that's aware. There's a standing order at any pharmacy that you can go, any person without a prescription, and receive Narcan, which is a life-saving medication, or in the future, we will be able to access that over the counter. This slide demonstrates and continues to further support the need for jail-based competency restoration. So we did work together with the Jail Oversight Board as well as County Council to support that we will be engaging WellPath to start a jail-based competency program to hopefully impact and decrease the wait time for persons to receive competency restoration services.
Warden, can you remind us on an expectation on time frame?
We are
Understand.
slated, at least the projected, and we're still working on that signed contract amendment with WellPath to start July 1. And this is a 5-bed competency restoration program.
Great.
As typically reported, we also include the grievances. It's important to note that right now we're doing dual processes in the institution. So we have some departments that have fully transitioned to electronic means, unless for whatever reason that person does not have access to a tablet. We are one-to-one with tablets. Some of our incarcerated persons have been found guilty to destroy or damage a tablet, so they may not be entitled to get one until they have paid for the damaged property. Those individuals would then be able to submit paper grievances. So we will always have a dual method of doing this. Not every single department is in an electronic format. We will update the board when that has occurred. And then religious services. We have seen a steady increase in-person religious services as we've been welcoming in volunteer organizations. For a period of time, especially related to COVID transmission rates, we were not welcoming all visitors into the institution. And we were doing predominantly just programs that might assist in somebody's reintegration. We've been able to expand that, and we can see a large volume of those numbers expanding. And before we do the final opportunity for questions from the board, I would like to invite our program and reentry administrator, Kelly Shaw, to the podium so she can make a few announcements as well. And then we'll both remain available for questions.
Thank you, Warden Williams. Good evening, members of the board and the public. Program and reentry updates for the month of March. Child and Family Focus Organization began facilitating life skills transitions, a 6-week course with the juvenile population on March 28th. The course is designed to help the youth navigate the transition to adulthood. Sessions build skills in goal setting, managing time and money, and building healthy relationships. Friday, March 31st, the Law Library offered a notary clinic to provide an extra opportunity for those seeking a power of attorney notarization for tax filing purposes. Thank you, Ms. Keith, our law librarian, for identifying the need and expediting a solution. Forthcoming this month, Pathstone Corporation will facilitate one-on-one sessions with our young adults between the ages of 18 and 24. The individual sessions will focus on resume building, job placement, vocational opportunities, and continued education. Upon release, Pathstone will continue services at no cost. The partnership will provide career and workforce development opportunities for incarcerated young adults that are not sentenced. Thank you. Can I answer any questions? Yes.
So the last part, young adults
Who are not sentenced, and that's stated as our current workforce development program. It's grant funded, and the stipulations state that you must be sentenced. So this is an opportunity for those who are not sentenced to get similar services.
the people who are not sentenced may very well be headed to state system. Because they're only, the maximum somebody can even do is 11.5.
Correct.
The
Oh,
majority,
I'm
sorry.
Okay.
The majority of our population within the facility is pre-trial, meaning that they are still awaiting any disposition or determination. So unfortunately, most grants fund individuals who are sentenced. And the reason for that is because you can plan when they are going to be released back into the community for discharge. That limits us though, because then we're picking from the exact same population for all of working to expand this concept of reentry for all. And making sure that we're finding ways to meet the gaps and needs of people who are not sentenced and will likely be returning into our community and would benefit from the scaffolding and support that these programs and services provide.
That, I did bring up to you the issue of people who refuse to come to court, and I know that you didn't want to impose anything that was punitive, but the fact that they don't come to court does not just impact them. I mean, I'm just thinking of a particular individual who is in all likelihood not going to remain in the county prison, given the charges he's facing, but has spent a goodly amount of time and even picked up a new contraband case, but has continually or has routinely refused to come to court. And it seems to me that something consequential should have happened, because consequences happen to all of us when we don't do what we're supposed to do. So whether it is limiting their tablet time, I don't care what it is, but there should be something, whether you call it punitive or consequential. I don't want to, as the judge, to get into picking out and targeting somebody who, just because I happen to know this is somebody who routinely and refuses to come to work at various times. and who therefore is staying in your prison when in all likelihood, that's not where he's going to end up, given the charges he's facing. And there's a whole lot of work that happens by other people when people refuse to come to court. It's not just affecting them. So you're right, it does have the way that getting case done, but not in the same way, like, that may be what they want, is to stay where they are, because the unknown is a little scarier.
I think the challenge for correctional agencies in general is that we are a member or an intercept within a larger criminal justice system. And we have a duty to protect Delaware County. That's the county that we serve, and we exist for the reason of holding individuals who are remanded to the facility while they are going through their legal process. We are the care, custody, and control custodians of the persons. We do not choose who comes to us, nor when they leave. We are not the judge or the jury to determine whether or not they are guilty of such alleged crimes. It's our duty to serve and protect those individuals and ensure that there is an observation of their constitutional rights while they're going through that. And so I do agree that there is a challenge. And if there is a process failure, that is the burden for the institution to make sure to address. And when an individual refuses to go to court, which it's perhaps I have the wrong belief, they get to exercise the right of free will. We have to make sure that we document that they have refused and communicate that, and that there could be a relief or resolve, but that is not for the warden or the institution to impose any punitive action for somebody who is exercising their right to refuse to appear for court.
Your Honor, I do take your point. I understand the ramifications that action on behalf of the inmate has on the wider community justice system at large. I think in the interests of time, what I might suggest is that, this be examined offline. I don't know, honestly, the legal ramifications of what the jail can or can't do from a punitive perspective if people choose not to go to court. Certainly.
They're exercising their right to not, it's not an invitation to my party.
So they are compelled and they are legally required or obligated to attend. And I'm not the legal expert, but I imagine that you could hold somebody in contempt for failure to comply with such order. But it is not at my direction to exercise punishment for somebody who did not engage in their process.
Yeah, again, and Your Honor, I'm not dismissing at all the concern. I'm really not. So please don't take my comments to diminish it. But I do know we're gonna lose this room at 6:30. So, but I think it's an important point that we explore offline and we can look at it in a larger context of what can and can't be done.
I was gonna say, I think we should explore it offline too, because it's something that honestly, I really was not aware of. So
Yeah.
I think it's a conundrum of people's authority, and it would be interesting to talk it over and hear what issues you're facing in the court and what issues the prison jail people are.
Gotten something that, particularly Judge Amoroso, I believe all the judges in the criminal court system, which there are 9 of us, have a similar concern.
And this is why we have judges on the Jail Oversight Board. I really appreciate your bringing this to our attention, and we'll take a look at it.
If we're leaving that, I just wanted to say congratulations to our program administrator, Kelly Shaw, who was one of the recipients of the award for, I'm not sure which incredibly great characteristic you displayed. There were probably a lot that you could.
Innovation.
But I think the warden said at the ceremony that you really leaned into it, and that was exactly what I thought. You really have leaned into it and really transitioned, helped us a lot. So I was really proud that you got that award.
You're here.
Thank you.
Are there any other questions or comments for the warden or for our deputy warden?
I had one comment for possibly the next time or in the future, but I've had some questions from people about understanding the handoff of people as they're leaving. And when we first came on this board with Mr. King and on the reentry, I'm just curious where we are at this point, and I'm wondering if we can maybe add that to a meeting at some point about how people are handed off back into the world when they're leaving. I've had people ask about identification and things, and I think that we've addressed some of that, but I think it would be good for people to know some more details if that's possible for the future.
Absolutely. I'll add it. Thank you.
Thanks.
All right, moving on. New business. Warden, I do think there was an agreement that I thought we were going to bring forward today for consideration, and if you can remind me the name of the organization and
Did I get the name wrong?
yeah.
So I
Sure.
apologize. Please let me reference.
And for the public's benefit, this is a real estate matter. There was some discussion on this in the executive session. So for transparency, I want to make that known. But if we can, at least give the broad strokes of what this is and put this to a vote.
The name of the organization is Delaware Valley Police and Working Dog Club. And this is an organization on Sunday mornings that does have access to some of the prison property grounds, of which there are hundreds of acres. This is not within any of the secure perimeter of the facility. The fields are utilized by volunteers who participate in these activities for training purposes with their canines. This is not associated with prison operations in any way. This was an organization that had previously utilized the fields for these purposes. We engaged the organization to ensure that they had professional liability insurance, of which they produced, and the county did ask that a contract be signed to make sure that that relationship was memorialized.
So this is an organization that for many years, more than a decade, they have used this tangential, it's part of the property, but it's not associated with the facility for a few hours each Sunday. And they've signed this agreement that ensures that there's not county liability exposure. Again, there was some discussion on this in executive session. I would welcome a motion to approve this agreement that's been signed by this organization. Is there a motion to approve? There you go. Thank you, Your Honor. Is there a second? Thank you, Your Honor. Motion is second. Any questions or comments before we put it to a vote?
I have a comment because
Sure.
I do think it's a solid agreement. I do think the county's protected. I do think it gives the county and prison flexibility to use the space as needed. But because I don't think there's a process for permitting people to go onto the property, which maybe has been there, I can't support it. So I do think it's a solid agreement, but for the reasons that the park department gives permits out, I think that we should probably come up with some policy that allows for that. So I can't support it.
Understood. Thank you, Controller Phillips. Any other comments before we put it to vote?
When does the agreement expire?
It would be updated annually, though it could, technically be expired at any time because the county does reserve the right to end the agreement.
Hearing nothing further, all in favor? Aye. Any opposed?
Opposed.
Opposed.
Okay, I think that would be 5-2. Aye, 1, 2, 3, 4. Ms. Love, were you an aye or a nay?
She had to leave at 5:30. Yeah.
Okay, so 4-2 and 2 not here.
Thank you.
Okay, any other new business for today? We can move to the second round of public comment. So if there's members of the public who would like to address the Jail Oversight Board, please come to the mic. And at the outset, please just give your name and your address. And there is a little timer up on the scoreboard there. So you'll know how much time left you have in the 3 minutes. That's it right there. Yep.
Hi, my name is Archanika Boyd. My address is 1920 West 4th Street, Chester, PA 19013. I have a lot of concerns as far as the prison is concerned. The visits are cut to a half an hour. You have this glass, this plexiglass. There's no sense of privacy. Everybody hears everybody's conversation. You can rarely understand what we're saying to each other because everybody's talking over each other. You don't even have the metal talking piece through the glass where you could talk through it. There's no privacy there. You on the telephone, you don't have no privacy. You get a half an hour. Why? What happened to the hour? Food, trash, it's no good. Then on the commissary, they went up in commissary, but then they took commissary things off the commissary. Things like cocoa butter, Vaselines. We're African American. We need these kind of things, okay? But in any event, she said the commissary kind of like was down or whatever, but that's why you took a lot of things off the commissary. That's needed for the residents. Okay, I understand they there, but still at the same time, they're still human beings. You take the TVs, you're making them pay for tablets, 5 cents per minute or something in that nature. The tablets, they don't stay charged long. You sharing the tablet, the phone staticky. It's a mess. I'm not understanding why even take the TVs? Why are they not even on commissary anymore? Why do we have to pay for programs on a pad that doesn't even stay charged long? I pay this amount for this program to play for an hour. It cuts out because it needs to be charged. So now I have to wait for someone to come get my pad to charge the pad. Then you're talking about mental health, taking the TV away. Some people are not socially engaging. They'd rather be to themselves in the cell watching their own TV by themselves. The mental health, that drives a person crazy. And they might not even have family to come visit. They don't have no comments. People don't have commissary. But I taught my son, you see somebody without, you give them. But that's not what everybody. Everybody's not going to do that. So there are my major concerns, and I think that it needs to change. And I have something to say about they're saying that the inmates refuse to go to court. No. I went to court. My son had court one day. I went to court. I'm like, where's my son? I know my son ain't refusing to come out that building when he got a chance to get some fresh air. Guess what it was? They were short on staff. So they didn't come down for court. Yeah, that part. So there's not all refusals. Now, there may be some, but it's not all refusals. It's because they short staff. But that's not our fault. That's not the prisoner's fault. It's the fault of the prisoner. Well, the prisoners are suffering. I'm sorry?
The speaker's time is up. Yeah. Thank you, man. Thank you, man. I appreciate your comments. And I think the warden got your remarks, and I don't know if there's anything you'd like to follow up on, but.
Hello, my name is Yolanda Smith. I live at 702 North 42nd Street, Philadelphia, PA 19104. I, like the previous lady, just would like to discuss the commissary and the treatment of the residents. The visiting is terrible. It's once a week for a half an hour and only 2 people are allowed, regardless of who those 2 people are. Then it's set up for, they tell you it's a contact visit, but it's set up non-contact. I took my granddaughter, I had to spend 20 minutes taking beads and barrettes out of her hair for us to have a 5-minute visit when she can't touch her father, she can't hug him. My son just recently had a child. He can't hug his baby, he can't touch him. And for a half an hour, for most prisons are an hour a week, and you can split it up to a half an hour over 2 days, or you can take a whole hour in one day. This place, it's set up for a non-contact, but then you have contact rules, like no jewelry, no this, no that. You can't do anything. To have the inmates use these tablets, it's cost consuming. I had to take a second job to be able to support my son while he's incarcerated so that he's not taken advantage of or put in a position where he has to do something that he'd rather not do. Like a tablet is 10 cents a minute. So if I'm going to watch a movie, which is typically 2 hours, that's $20 every day, all day. Like, who has that? I don't even pay that for my cable bill, and it lasts all month. So these are the things that I really think need to be addressed in terms of the mental health. Like she said, some people are not sociable and rather be to themselves. And things are just not in order in that institution. You have an inmate you have a guard who decides what is appropriate for somebody to wear, because if she feels as though it's too tight, who is she? Like, I wear my clothes the way I wear my clothes now, holes and stuff like that, certain attire I understand, but the things is ridiculous. Most pants now are made with cuts and rips in them. I had on a pair of jeans, you could not touch my body in any way. I couldn't go see my son just because the design of them appeared to be rips and cuts. It really needs to be something done. They seem like they have no oversight. They do what they want to do, and it makes no sense, because I've dealt with other prisons throughout the county, and things at George Hill are not conducive to the community or the inmates.
Thank you, ma'am.
Oh yeah, and they brought my about the thing about refusal. My son had to come to court, who is a 25-year-old black male. Yeah, they had a 58-year-old white male.
Thank you, ma'am.
Thank you.
How you doing? My name is Shamira Miller, and I live at 119 Long Lane, Upper Darby, PA. Sorry about her noise, by the way. So I did want to bring attention, kind of seconding what they just said, pretty much emphasizing the COs. I think there needs to be more screening on the workers, because they are very disrespectful. They do a lot of things that are inappropriate to inmates, and they get away with it because it's their word over the inmates. And so I think there needs to be more attention brought to the people that you have, that you call COs there. As far as like feeding, like the eating, I mean, you guys wouldn't even feed that to yourselves. So I feel like it's close to dog food, honestly. While the guards have kitchens with real food, chicken wings, good stuff that we would eat on a daily basis, but giving the inmates something that's not even edible. The law library, inmates aren't able to really spend time there. When they lock inmates in, they let them out late. Yeah, they let them out late, but then they have to go back in their cell early, which is not fair. And as far as like the TVs, I've spent thousands of dollars since my relative was enrolled in the George W. Hill, and just literally, like, I can't tell you how many times they just took his belongings, like, didn't have a reason. They just, they didn't give them a reason. And I spend my hard-earned money for that. So I feel like that's inappropriate. It's not respectful to us who are spending thousands of dollars each year on inmates. Exactly. Another thing that I wanted to highlight was lowering, I think we already talked about that, was lowering the cost for the tablets. Because like I said, we don't have all this money to just keep putting into this stuff, and it's like not being respected anyway. So, yeah, so pretty much just evaluating COs, when an inmate puts in a grievance, actually evaluating those grievances, because I've seen sexual harassment in an inmate, and a CO just living like it never happened and lied about it. So it's like that needs to be investigated. And yeah, so I think that's pretty much, another thing I wanted to highlight is it's almost like whenever there's an issue, it's almost impossible to get in contact with somebody at the jail, especially the warden. I've left messages on the warden's phone. I've left messages on counselors' phones. Nobody gets back to me at all. And it's like nearly impossible to get in contact with anybody. And I think that also needs to be looked into as well. Thank you.
Thank you, ma'am. Is there any other public comment for today? Hearing none, board member comments. Anything further from board members for today? If not, I would entertain a motion to adjourn. All in favor? Aye.
Aye.
Any opposed? We are adjourned. Thank you all.